You know, autism comes in many forms, and the impact on families is just as varied. We've shown you some of them over the past several weeks. Families trying to care for a child in their own home, others turning to outside help. Now we want to show you a third side, that of the people who deliver news of an autism diagnosis to families. Welcome to Dr. Nate Noble's world.
Mommy!
What?
Where the vibe is high energy.
Get over here! Get in here! Look at you!
And the doctor-patient bond is tight.
Go show it to him.
Let me see where the thing is. Hold on. That's me?
Who is that?
Is that me?
That's right, Moby has a picture of Dr. Noble hanging in his room.
That is hilarious. That is hilarious.
There is a lot of love and laughter here, but also heartbreak.
Before lunch, every day, it's very likely that I will have participated in a conversation where I have told people the hardest thing they've ever heard in their life.
You see, Dr. Noble's specialty is developmental pediatrics.
How's school?
Good.
Developmental disabilities covers a lot.
Yep.
Tell me what you've seen, though, when it comes to diagnosing autism over the arc of your career.
When you think about individuals with an autism spectrum disorder, the prevalence is very high. Developmental disabilities or neurodevelopmental disorders are common. So 1 out of 6 kids, 17% of the population. So when people ask me, why is your wait list so long? I say, it's just math. It's a math problem.
According to the American Academy of Pediatrics, there are only 758 board-certified developmental behavioral pediatricians in the United States. That's to care for the 19 million kids with developmental or learning disorders. The wait to get an appointment here isn't as long as it once was, but Dr. Noble is still just one of a handful of Central Iowa specialists qualified to diagnose autism.
Yes! I am also excited about that.
So what are we talking about then? What sorts of things do you look for or see in kids that raises that flag?
Autism can best be understood as a decreased or diminished intent to communicate. And that's just from doing this for a decade. I don't know that you'll find that in a textbook, and certainly people may disagree, but from my perspective, it's assessing an individual who could do more to communicate but doesn't have that value system just yet. So whether it's a delay in the emergence of a point, or the delay in the response to the name being called, or the delay in the use of expressive language to get needs met, or to garner attention or affection. That way it kind of captures individuals who use no language or emerging language, and individuals that talk all kinds of things. They say all kinds of things, but it's really just about a very narrowed and specific interest. So they're not necessarily trying to communicate with me. They're telling me things, but there's no this.
Right, because that's what communication is.
Yes.
It's what we're doing.
Yes, it's the
back and forth.
transference of ideas back and forth.
Seeing a kid like Moby go from being totally nonverbal to this.
Mom? What? Want to go to Chick-fil-A.
You want to go to Chick-fil-A?
Is a huge payoff. But Dr. Noble's reason for doing this work is also personal.
I was diagnosed with Tourette syndrome when I was in maybe kindergarten, first grade. That had certainly an impact on me in regards to just the sensitivity of individuals who are up against barriers or obstacles.
It took weeks to come off of it.
From trouble communicating and sleeping to seizures, gastrointestinal and immune disorders, anxiety, depression, ADHD, and more.
It's challenging to find services in the summertime.
It's a lot for families to handle, and Dr. Noble tells them it's okay to mourn the child they don't have.
It's only when you come to terms with the child that you don't have, that you have the strength and fortitude necessary to be the person and love the child that you do.
He's got trained. He's got trained.
And this is going great.
He also makes sure they know they have no reason to hide and nothing to be ashamed of.
I encourage a lot of families, like, listen, live your life. Live your life. If you're around people who spend their time being annoyed by the fact that your child can't stop touching the doilies in their house, get different friends. Get different friends. Bring them to my house. I don't care if they jump on my couch. I don't care if he's doing a thing with his hands. Live your life, brother. You're fantastic. If your kid's out and taking some swings at the bat of life, right? Taking some steps to the plate and it's not going great. Good for you. Good for you.
That's how you make progress.
That's how you make progress. It was nice to Woo!
I can attest to the fact that most appointments are like that. Dr. Noble has worked with all of the families we've introduced you to over the past month. You can find all of those stories at WHO13.com. Just click the news tab and then look for Understanding Autism. Next week, we're going to tell you about programs that can make a difference and why treatments are out of reach for thousands of Iowans. Janae, we're also going to break down how the state is spending more than $100 million in federal funding to study the current system.
Okay, breaking down the numbers, but yeah, no surprise that Dr. Noble's picture might be in more kids' rooms.
No doubt.
Thanks a lot, Erin.